Again. All right, there we go. We are live. We are live. Dr. Steller, how are you doing today?
I'm doing pretty good. Can't complain.
Perfect. Well, thank you so much for being here. It always takes up just a little second for it to kind of kick into Facebook, kick all the way over to YouTube, but it looks like we are having some folks join us now.
Great. Welcome, everyone.
So yes, welcome. Let's see and let us know if when you're here, when you're back, if you've come back from some of our previous ones. We're so excited to have you here. So this week we are going to be talking about health and behavior in shelter cats. Now we will talk a little bit about dogs, but mostly cats in this scenario on here.
Now I wasn't told about the dogs.
you were told. You're like, I'm only prepared.
Only cat.
All right. Well, my name is Dr. Chris Menges. I'm the Chief Veterinary Officer here at Basepaws, and this is our webinar series. Now with me today is Dr. Julie Steller. And she is the veterinarian from Minneapolis Animal Care and Control, which is the largest animal care and control within the state of Minnesota itself. Now, she has a fantastic background that I am going to mangle a little bit, so I'm going to let you kind of go ahead, walk us through. How did you get to become a shelter veterinarian and kind of specialize in this more population medicine than what we normally see?
All right. Well, I've been a vet for 17 odd years now, which is very hard to believe. And, as I was saying to you before, I started out in private practice, like pretty much everybody does. And it was fine, it was all right. But an opportunity finally came to apply to work at a shelter. And I didn't even know what any of that was about. We never got any of that really in vet school in the late 90s, early 2000s. But it seemed like an interesting opportunity and I needed a job. So honestly, they hired me and I just found out that it was really it's a great job for me personally. My personality and my skills really translated well to that work. And so I've sort of hung on to that now for the last 11 years, doing other things as well. But for the most part, that's my main love and passion is shelter medicine.
Perfect. And when you say kind of your skills and kind of your passions, what specifically draws you there?
To be completely honest, less client interaction, which is, I don't want to, say that that's horrible. Most clients are awesome, don't get me wrong. But as time has gone on, it can be a little bit more of a challenge. Everybody knows about how stressful it is in the medical profession. And I get to focus just on the animals when I'm a shelter vet, and I don't have to worry about the person attached who's got their own agenda or, usually those agendas are a positive, but I can do, what I need to do with these animals and, kind of look at them at my own pace, and I don't have a 15-minute appointment and then another 15-minute appointment. And, when we do a lot of surgeries, that's intense, but I also have always had kind of an affinity for doing surgery. So when you're a shelter vet, you do a lot of surgery. So you have to have certain skill set for that. There's a lot of vets who don't really like to do surgery. So I don't know, all those things kind of came together. Nothing is ideal or perfect. There's definitely downsides to everything. But for the most part, it's the thing that I've enjoyed doing the most in my career.
Well, and that's so great to hear. Yeah, I mean, we hear more and more now about the stresses that are going along, with small animal practice, more rather with practice in general, and from that standpoint. And there's so many different opportunities in the veterinary world that we're so excited to have you here, and I'm so glad you were able to find that. You mentioned some vets that don't like to do surgery, and that was never my forte. I'll gladly let you do all of my surgeries. Now, we're going to start to move a little bit more into kind of shelter medicine and cats and from there. And so I have a disclaimer. We got to say, this is an educational webinar. And so these are not intended, any of the advice or education that we give here are more of a general education and not intended for specific case management of a cat at home. If you do have any questions, if you do have more questions after that, of course, we always want you to talk with your local veterinarian, treating veterinarian before you change any diet, you change any, toys, anything like that, just to make sure that it adheres to the current caseload from there. But yeah, so kind of as we move back towards the shelter, you say it's a lot of surgery, and then it's how often you mentioned you really get to focus on the animals. So when you have cats come in, how long do we typically see those cats? So do you normally get to typically see those cats within the shelter scenario environment?
Well, it's really very much a situation where you have cats in cages or cats in a colony room or whatever, and you'll have a list of issues that you need to address for each animal, or many of them are healthy, so you don't have to really do anything with them, and you just have to be kind of a self-starter and good with your time, because you're on your own. You got to go around and address these issues in the time that you have, and some people learn how to stretch that time out, and others can get a lot of things done. So, there's usually no constraints when you're just doing the medical side of things. You can kind of go and look at things as you want, triage what's more important, what's an emergency, and then kind of go about figuring out what you need to do. And to your point before about, seeing your vet, if you have a particular issue, we're tasked with the public health or the population health as a shelter vet. So even though we are dealing with individual animals, we have to think about the greater good and what's best for all of the animals in the shelter at the same time. So that's why we, when we deal with diseases and stuff, it's not just like, oh, this particular animal has this disease. We need to think about how that might affect all the other animals that they're going to come in contact with, especially in a shelter environment where it can be crowded at times. I mean, luckily, I haven't had to deal with that where I am in the Midwest, and we don't have a huge overpopulation problem. But down south, that's a huge issue, and disease is a huge problem down there.
Certainly, we do have a lot of very busy shelters down here. It's kind of Texas, Florida, California area as well. Now, one of the things it's really interesting is, when you say you have a cat come in, how long does it live in the shelter before it typically leaves the shelter, either to where does it go after it leaves?
So that is such a varied answer, depending on the individual animal. Some, when we get kittens in, if they're 8 weeks and older, they usually leave the shelter almost immediately, because they are generally healthy and they can be spayed and neutered and out to adoption or out to a rescue if they need to. A lot of times we do get kittens in that are sick, though. They will have respiratory issues and eye issues, and then they either might go to a foster home or be in the shelter long enough to get healthy enough to go out to adoption. When you're in the shelter world, the biggest thing you worry about is length of stay. So how long those animals are in the shelter, because it's stressful the longer they're there. They tend to get sicker the longer they're there, or have a chance to get sick. So healthy animals that come in are usually out the door pretty quick. If they're already spayed and neutered, we can really get them out the door quick. If an animal comes in injured, or somebody is surrendering them because they have a medical issue, then it really just depends on, can we treat that in shelter? Should we treat it in shelter? Should we get it to a foster home? Should we get it out to a rescue so that they can get it to a veterinarian? Because honestly, at shelters, most shelters, there's very limited resources, and you can only treat the kind of basic things. So we always stress just trying to get them out the door as fast as possible, but it really just depends on, what they came in with.
Yeah. Now, I'm gonna throw this question at you. What's your longest stay that you can think of?
Well, there are dogs that have technically, you have to say that they've been in the shelter for, even if they're out in foster. But there have been, when I worked at Animal Humane Society, we treated heartworm dogs, and many of those would stay several months, because if we couldn't find a foster home for them and we treated them, we wanted to make sure that they were good for adoption. So they may have stayed for several months, but technically there's been dogs that have been there 8 months, but they've been back and forth from foster. We have a dog at MAC currently that's been there since the beginning of the whole COVID outbreak, because she was involved in kind of a legal case and very, very emaciated when she came in, and we had to work with her to get her back to health. And, she didn't have the socialization she needed, so she has some behavior issues she's working on, and those are a lot of the time the long-term ones, the behavior issues. With cats with kind of unsure behavior, a lot of the times we have other outlets for them than dogs. So, if a cat comes in and it's pretty likely feral, We can oftentimes just spay and neuter them and then put them back outside. You can't really do that with a dog. So, yeah, I mean, you shouldn't anyway.
Now, we are starting to have a couple questions roll through, but Harriet asked the first question. I just want to, that's the perfect place to ask it. Just ask them in the comments and we'll get to them from there. I forgot to mention that. You can just put them in the comments as we go through, and then we'll always get to them. Now, you mentioned the other outlets, the putting them back outside. When you say put them back outside, what does that really look like from a different scenario than we see in dogs?
So generally, a big thing in shelter medicine and the rescue world is what's called TNR, which is trap, neuter, release. And sometimes we'll do that specifically, have people catch cats that are wild and bring them in and get them spayed and neutered, them back where they came from to, help minimize the pet population, overpopulation. Sometimes we'll just get a cat in that somebody's found and they're thinking, oh, great, well, I'll bring this cat in, we can get it adopted out, but maybe it's not going to have the behavior for that. And then you always want to try to put that cat back near where it was found. Because sometimes it's actually somebody's cat and it's just scared, because someone picked it up. And that's the thing with shelters, bringing a cat in, it's not a great environment for a cat, no matter what. And sometimes the stress will make this cat seem feral when it's not really a feral cat, it's somebody's cat. So if you can spay and neuter it and put it back where it came from, somebody just might get a free spay and neuter out of it once their cat goes back home. But that's generally the case, is putting them back where they were found is probably where they've been living, or they live somewhere near there.
Well, I saw a really interesting stat on y'all's website about, cats that are lost. It seems they're 18 times more likely to be found still out in the environment as opposed to in the shelter itself, which is an extremely, interesting stat to hear. And so that TNR, the pulling them in and bringing them back is such a great way to do that. Now, you mentioned you mentioned behavior issues for dogs, and then of course the feral from cats. Now, Harriet, her question was kind of along these lines. She was talking about how she works to socialize kittens at two different shelters. But, and that's kind of from a behavior standpoint. Do you see how long do you typically take to see behavior changes in your shelter cats, or if you even really get to? Now, she says in hers, of course, often our cats are adopted so fast, she feels like she doesn't really get a chance to make a difference.
Yeah. And socializing kittens is kind of its a whole own thing. But, any socialization you can give to the kitten, even if it's a day, is going to be helpful. So Harriet, don't feel bad if you feel like you haven't gotten a chance to do anything, because you're doing good work. We'll get little kittens in that are 5 weeks old or something. They don't have a mom. They're hissy and spitty, and they don't want you to touch them. And a lot of the times after a week, they'll be a lot more accepting of our love that we, force upon them, kind of. But, it can take several weeks for those kittens to turn around. If you've got one that's already over 8 weeks, say, 10 weeks, 11, close to 12, those take a little bit longer sometimes because they've sort of missed that prime period of socialization before like 7 to 8 weeks. And so you've got to work with them a little bit more. The good thing is when they do go to their homes, generally it doesn't take too long for them to turn around, because they're in a home then and they're not in a shelter, which is so stressful. And they've got a new loving family that wants, probably also forces their love upon them on a daily basis. So, whatever you can do to socialize kittens, and really it's not a complicated thing. You just play with them, you handle them and you touch them and you kind of make them do your bidding, because they can't really hurt you. As far as older cats are concerned, or adult cats, it really depends on the cat whether you're ever going to get them to quote unquote turn around in a shelter if they're really scared. The majority of cats that come in are really tolerant and great friendly cats, but occasionally you get some in that they already might have a history in the home of being shy. Those are the ones that are probably going to not do so well in a shelter. So that's something to keep in mind if you have to surrender your cat. If it's shy already, it's probably not going to do so great going to a shelter, and you should probably find a rescue for it instead, where it can be in someone's home. But it all takes time. And yes, if they're a little bit older and, they're getting adopted before you really have a chance to see a difference, please don't feel bad about that. You're doing what you can. And I've seen these cats get better. Even in tiny little incremental improvements on a daily basis are what we're looking for.
Perfect. Yeah, and that's such a key thing, is those little bits of time. Now, you mentioned that they are going to homes so often and so quickly with kittens. When they're healthy, you're able to spay and neuter them fairly quickly, and then be able to move those out to homes. When we start to think about bringing a cat home from a shelter, you mentioned that this is a very stressful environment. So bringing a cat home from a shelter, is there any advice that you would start to really think about, kind of some of the first advice that you would give owners to help with that transition period back towards home?
I think with kittens, they're pretty easy. I mean, other than the fact that they can be incredibly annoying, like any young animal can be, for the most part, unless they're really shy, they're going to be fine. You're going to get into that routine. It's when you take an older cat home, that's kind of already through that socialization period, unless they're just a super friendly cat already. If they're a little bit shy, you have to realize that they might hide for a little bit, and that's totally normal. They also might not eat any food for a few days to a week. That's also totally normal. A lot of people get real nervous when they take a cat home and it hides and doesn't eat, and think that they are sick, or it's a dud or whatever. And any cat coming from a shelter to a home can go through that stressful stage. So even if they're friendly as can be in the shelter, all of a sudden we've put them in a box and they've gone into a car and they've gone to someone's home, they're going to be a little bit stressed out, especially if you have other animals at home. You've got to do very slow introductions to any cats or dogs that you already have, and spend a lot of time with this cat, not necessarily mauling the cat with your hands and loving on it if it doesn't want you to do that right away, just letting it come to you. But it's all transition period. And I would say it's easier to do that with cats than it is with dogs that are adults already, because cats are just a little bit more forgiving. They can kind of go off on their own and have a little alone time, and you don't have to worry about, well, we got to get you outside because you got to go potty, and how am I going to get this leash on you, kind of thing. So I would say cats aren't that bad of a transition, but you have to make sure that they can get to their litter box. They know where the litter box is. They know where their food and water is. And then just leave them alone right away if they're looking a little bit, unsure about the new environment.
Yes.
And don't be afraid to take a cat home like that as well. Those cats really need homes. The other ones that are all friendly at the front of the cage and rubbing on everything and meowing at you, people are going to adopt those, no problem. It's the ones that are hiding under the cot that are a little bit more shy. I mean, that's my kind of cat, honestly. I don't want the cat laying on me and rubbing on me all over me. I like the ones that are a little bit more aloof. So don't forget that those also make really great pets. And if you're going to get a cat, period, or a dog, go to a shelter and get one, because they need to get out of there as fast as they possibly can.
Yeah. And you mentioned that transition period for cats, being able to kind of have them, leave them alone a little bit. Is there any kind of specific arrangements in the house, particularly if people have other pets, that you like to kind of have them acclimate to the smells?
I mean, sometimes the best thing is just when you bring them home, kind of leave them in whatever carrier or box they are in for a little bit. If you have, just let them chill in a new environment. Put them in a smaller room that you have, an empty room or a bathroom, and then open up that box. Let them come out as they want to. Don't go in there and get them out. Just let them come out of the box on their own, and then kind of check out the smaller space. And then, under doors and things, other animals will be able to come and kind of smell through there. So that's the important thing, is letting them smell. And then sometimes after they've kind of spent a couple of days in that smaller area, you could switch your animals around, put the new one in the, established one's area, and vice versa. And then they can smell each other's smells, But it really just depends. Some animals, you can just integrate them immediately. I wouldn't recommend that for most animals, especially with cats, because they can get a little bit touchy with each other. I mean, you're not going to have the problem you would have with two dogs going at it necessarily, but cats are just weird animals. I mean, they're awesome. I love them, but they do their own thing. You can't always predict what their behavior is going to be. And, you just never know. You might get two that are just like curled up together all the time. And then you get two that like could barely tolerate each other. So that's the bad thing about bringing multiple animals home that are litter mates, is you just don't know how they're going to react to each other. But you can also help that situation along by doing it right and slowly, not just forcing them to be friends. Right.
Well, and those transition periods, and we've talked a lot between on this and previous webinars also about how cats behave and how cats communicate with each other. But we do, I also mention this to you, we do also have a service called Coach My Cat that we have a registered veterinary technician that can talk and help. So folks, if you do have some of those behavior issues on there, you can see if Coach Becky can help you out with some of those as well. Now, that's so important, that transition period of keeping them kind of separate and letting them acclimate to the smells, because cats are generally not as much pack animals as we typically see for dogs. Now, we do have, a lot of different, we've got some really interesting questions about we have one that came in from Kristen. But you talked about spay and neuter in these kittens, these 8-week-old kittens, and some people don't, what's her question was, can you comment on the pediatric spay and neuter? So when kittens are approaching 2 pounds, if that's, how do you feel about that? And the safety of the procedure, just kind of the general approach there.
So I'm a shelter vet, and we are all about controlling the pet population. Yes. So any animal that's going to leave the shelter needs to be spayed and neutered. And we do that starting at about 8 weeks. And as far as the 2 pounds is concerned, I've done them as small as 1.5 pounds. And they do great. I would say they almost do better than if they're older, because they act nothing like something that actually happened to them at all. They literally wake up from anesthesia and they're running and jumping on each other and, eating food. And
you're like, stop, wait.
Right. you let them do it at this point. But, when you do so many surgeries in a day, and that's a main part of what you do, you get really good at the anesthesia, and you get really good at very quickly spaying and neutering. I mean, it takes, less than 5 minutes to spay a kitten at that size. And so it's so safe for them to go through that procedure. Occasionally, are you going to have an anesthetic problem or a kitten with a undiagnosed heart condition or something? Yes, you can have those issues, but that is so very rare. And for me, especially in cats, it's really important to get them spayed and neutered as soon as you absolutely possibly can. They don't have those issues like you've maybe read about with dogs that, we should wait until they're a certain age because there might be some problems with cancer or their bones growing too long or that sort of thing. When it comes to cats, you don't want more cats in your house later on, when your cat decided to go out and come back pregnant. So it is really safe. We know what we're doing as far as that is concerned nowadays. It's amazing how efficient it can be to do high volume, high quality spay neuter. And I would not be too concerned about them getting done at such a young age. The only thing you really miss out in with like the male cats is they don't get those big faces and those, giant muscular bodies that some people just love, the big cheeks or whatever. You're not going to get those secondary sex characteristics when they're neutered at a very young age. But trust me, we get plenty of those in the shelter that haven't been neutered. So you can go find one of those to adopt later on. If you
have other avenues to fill that need.
You always will. Yeah.
Now, I've heard some really interesting stats about the number of cats that you have to kind of, if you take a feral population, the number of cats that you need to spay or neuter to kind of maintain steady state. And I just kind of like to hear if this kind of sounds right from there. The numbers I thought were about 70% of the cats to kind of maintain a steady state kind of population. And is that correct, or am I off from there?
I mean, it sounds about right. I think it really just depends on the population of cats that you have in that colony or whatever it is. If it's mostly females, you're going to probably need to get more of them spayed, more than that 70%. But it does have to be a pretty high amount, because everybody has heard the how one cat can have 14,000 kittens or whatever in the span of a short number of years, because they tend to have litters of 4, 5, 6, 7, 8 kittens. So you do have to have a pretty high number of them, spayed and neutered, and you can think that you've got the whole colony spayed and neutered, and then here comes another cat from, down the street or whatever. It just, it takes one male to start impregnating all of those females. So, and TNR is a controversial subject. Some people are really against it because they think that it just, all it does is decrease the bird population, and we should just, we shouldn't have these cats outside because they're just going to kill wildlife and that sort of thing. But the alternative is to euthanize cats that are living outside. And there aren't too many people you're going to find in the rescue world that are going to be, on board with that option.
I'm not sure there's too many people that you'll find
right
in the general world that are going to be on board with that option.
Right. The same people anyway.
Now, we talked a little bit earlier about how how up in the Midwest, there's not as much of a population crush towards the shelters like there is in the South. And Harriet had another question. I'm going to kind of pop in from here. And Harriet, you say last question. You can keep asking questions. We'll be happy to answer them on there. But she mentioned in the Northeast at many of the shelters, their dogs and cats and kittens are flown up or brought up from the South up into the shelters themselves. Have you had any experience with that? Do you know if there's any kind of long-lasting effects from that, or is it just kind of like the kittens that get spayed, where they just show up and they are happy to be playing the next day, or the moment they get off that truck?
So I can speak to that through my time at Animal Humane Society in Minnesota. Here, they get a lot of animals from the South as well. Transports, huge amounts of transports on a weekly basis, and more dogs than cats, because you almost never need that many more cats in your life. But we get cats from other places in northern Minnesota and that sort of thing. And in my experience, they actually do really quite well with that. It was something I was really concerned about when we first started getting all these transports, is the stress on these animals coming up from maybe a 13-hour car ride or things like that. That's a long time. And yes, there's stress involved with that. You're never going to be able to mitigate that completely. But you'd be amazed how resilient. I mean, dogs and cats are just super resilient animals. And I would say that for the most part, you need long-term stressors to traumatize them for life, as it were, unless it's something really, really hugely traumatic. But going in a van or a truck for 13 hours does have its stress, and we always worry about disease spread at that point. But generally, unless they've already previously had some stressors that have kind of traumatized them, just that transport is not going to be enough to, scar them for life, say.
Mm-hmm. It's kind of a unique enough stressor that they're like, man, that was weird. I don't really quite know what happened. It seems a little bit chillier here, but
right. I mean, ultimately, you have to realize that they're moving to a better situation.
Yes.
Not that the people in the South aren't doing the greatest work they possibly can. It's just they're overrun down there. And so animals that get to come up here are the special ones that are, they're starting a great new life, especially in this area. I can't speak for the Northeast or whatever, but I'm sure they're having great lives there too. But people in the Midwest here, they just, you can almost not get enough dogs up here for people to adopt, and people are always adopting kittens and young healthy cats. There's always an issue with cats that don't use a litter box. That's probably one of the biggest issues that you have in a shelter, is when people surrender their cats, it's usually because they're not using the litter box, and that is always going to be a huge problem with cats, because they're using it inside your house, and if they're not using it properly, that is really a problem for people in their houses. So we do get a lot of cats at Humane Society surrendered for that reason. And a lot of the time, there are some factors that have happened in their home that maybe contribute to that a little bit without people necessarily knowing it. There's maybe too many cats and not enough litter boxes, or there was a dog there that was stressing them out. And a lot of the times, if you can just get them into a different home with a little bit of a different environment, those litter box issues resolve themselves, which is really great.
Mm-hmm. And, we've talked a lot, sorry about that. But we've also have, and folks, if you mentioned the litter box issues from there, while litter box is the main reason that cats do get surrendered to shelters as well. We do have a couple of webinars, and then also Cats and Coffees with Coach Becky about litter box issues because it's so crucial. We'll constantly talk about it and always go from there. Now, when you talk about that, we kind of talked about that transition period. Is there anything specifically you recommend for people who are taking cats home that have had those issues in the past? Or what do you normally, how do you help that situation?
Well, I would say usually if you're going to a reputable shelter that deals with that problem a lot, they're going to have some education and literature for you as you go out the door with your cat and how to introduce them to your home and deal with the litter box issues that may crop up. I think that, all vets and people have learned sort of the standard, like N+1, you need to have one more litter box than you do cats.
Mm-hmm.
And that if you have 4 cats, you got to find space in your house for 5 litter boxes like that. You need to do that. It's a big factor. And don't put one next to the dryer when the signal goes off and the cat freaks out because, there's this loud noise when it was trying to relieve itself. And when you do have multiple cats, there's the issue of them potentially, jumping on each other when they're in the box. So some cats prefer having a covered box. Some prefer it being open. Some just don't like the litter. So yeah, they're picky animals, and this is what makes them frustrating a lot of the time. They're awesome companions, but they want things their way. So a lot of it is just learning what your cat likes and having that patience for it, and cleaning out the litter box on a daily basis. A lot of people just, think, no big deal. I'll just do it on a weekly basis. Some cats are fine with that. My cat doesn't care, but, there's all these things you can do. You just have to educate yourself. That information is out there. And if it gets to the point where you really just cannot manage it, and you've been to your vet and you've, tried to do all the things you can, ruled out a medical condition, because that's a big one. We got to rule out that there is an infection or stones or something. Then sometimes, you have to make that hard decision to try to find a new home for the cat, or, maybe it's a cat that just wants to be outside, because there's a lot of cats that we take from outdoors and we make them kind of house cats, and maybe they would prefer to live outside. And that's why they're not using your litter.
Well, like I say, there's always, like I say, there's a lot of preferences. They are so unique. Just kind of, like I say, we kind of anthropomorphize or give them a little bit of human personality characteristics. But right. I think cats personify that a little bit more than dogs do with all of that.
They also take that and they roll with it. They're little divas, and but they're great animals. They're just a lot of fun, If you get a kitten, you just got to realize that, or a puppy, if you get any animal, the bottom line is they're a living being and they have their own personalities and quirks and foibles and whatever, and you're going to deal with that for the next 15 years or whatever. And so we don't want them in the shelter. That's the bottom line. Like, I'd be happy if my job was eliminated because we didn't need shelters anymore. Yeah. As much as I love the work, it's stressful. Stress is the number one thing that we have to try to mitigate in a shelter. And it's hard because sometimes it's too crowded and they don't have enough space and there's nowhere for them to hide. And the dogs get tired of being in the same place all the time and not being able to go on a walk and all of these things. It's not an ideal environment for any living being, honestly.
Of course.
The bottom line is, when you get a cat or a dog, that's your buddy for life. And so hopefully you can find the resources you need if you're having some struggles with whatever.
Well, also, and helping in that transition, we say a lot about, and I think it kind of came a little more from that Jackson Galaxy or from Pam Johnson Bennett, to think like a cat or catify your home. So folks, there are some great ways to help shift your thinking from a human-based perspective into the home toward more of that cat-based kind of like what is the cat generally seeing from there. But there's some, like say, some great resources out there that we can follow up with. You did mention a lot, of course, getting them out. That is a stressful situation. You want to move them, get them out of that stressful situation as much as possible. But I wanted to talk a little bit also about diseases. Why you mentioned that the longer they're there, the more stress and potentially more disease that can kind of be picked up. And what do you typically see, and kind of how do you mitigate those diseases?
Yeah, I mean, it's just like human beings too. The more stressed you are for the longer period of time, your immune system goes down a little bit, and you're more susceptible to all the things that you encounter out and about. So at a shelter, if the animal gets stressed and their immune system decreases, then suddenly they're exposed to all the things that could be in this very enclosed environment. So, with cats, the biggest thing we obviously deal with cats is upper respiratory disease. And if you have a lot of cats in a small area, you're going to deal with that. You can't stop it from happening. A lot of the times these cats come into the shelter with a infection or respiratory something, and then sometimes they're just carrying it without showing any signs. Kind of like the COVID thing. I mean, it could be out there and you don't see any signs. So you got to try to keep those cats separated. And it's hard because you're dealing with a cat that's sick, and then you got to go deal with a cat that's healthy. And so you have to make sure we're washing our hands and we're doing the proper, protective things that we need to do to not spread those germs around. And so, URI is fairly easy to treat, and most cats get mild versions of it and they get better. It's the kittens that come in and get really sick, that already don't have great immune systems, and then it gets even more weakened, that it sometimes can be hard to deal with because they get really sick. And cats want to smell their food. If they cannot smell their food, they're not going to eat the food. And so those kittens won't gain weight, and those are the ones we try to get to foster homes to treat. But for the most part, we've got a pretty good handle on upper respiratory. Now, the viral diseases that come in with, that cats come with like feline leukemia virus and feline infectious, peritonitis and whatever, those things are not necessarily hugely transmissible in a shelter environment as long as the cats aren't, mingling. But there are a few diseases like panleukopenia, which are devastating. So that's not a disease we want to spread around a shelter. That will, potentially shut a shelter down. So we always are very, very kind of on alert for signs of those diseases. Luckily, it's not that common. At least up here in the Midwest, it's not really that common. But, when you have an outbreak in a shelter, be it parvo with dogs, panleuk with cats, ringworm, don't get me started on ringworm. It can be devastating. You can have so many animals, ill at a time, and with really diseases that can be pretty deadly.
Yeah, deadly. That can be the tough area. We always want to make sure our shelters are, and I think you mentioned that length of stay is so important to bringing them through or getting them out. And so, while we think about shelters, sometimes we think about shelters as kind of this repository where animals get picked up, whether it be forever. They come to the shelter, they hang out for 2, 3, 4 days, spayed and neutered, and then they get adopted out. But there's a lot of other different venues for that leaving besides just adoption, isn't there?
Oh, absolutely. So at a place like Animal Humane Society, the majority of their animals leave via adoption. I mean, that's what they would prefer to have happen. But you have to think about, like, some animals get surrendered and maybe the person changed their mind and come back and get their animal. Or a stray comes in and somebody actually, claims it and gets their animal back. So animals leave via going back to their owners. Animals leave via adoption. They also leave via rescue organizations that are more foster-based. So sometimes if you have a dog or a cat in the shelter that isn't really just quite ready to be adopted, just has some behavior issues that maybe need to be worked on in a home, that's when you can partner with rescue organizations that do not have a giant building housing animals, that can take them and work on their behavior issues, or get a cat more acclimated to a home environment, and then they can just go to another home environment. And it's a much easier transition than going from the shelter to the home environment. So there's a lot of different ways animals can leave. And obviously we always really work on live release rates. So we always want them leaving the building alive. And so we do all that we can to make those euthanasia rates as low as possible. And I think that a lot of shelters do a really good job of that. And unfortunately, some shelters are so overpopulated that they struggle with that aspect.
Well, that's something that we never want to hear. Being able to have those resources kind of effectively really increases that capacity of your shelter to find and give those animals the care that they need when they come in. Now, this you mentioned the home environment. We have a question from Abby, and this is going to just take up all of our faces right now. But I'm going to read it and pull it back down real quick. We are still here. So now she said, when cats are surrendered to the shelter, the owners say they're very friendly, which as we know may be true at home, but coming into the shelter are stressed and not as friendly on there. Do you think that having something from their original home, like a toy or a towel or a bed or something, helps calm them down, or does it make that transition period a little harder for them?
I would say it probably doesn't have very much effect at all, either way. If the cat is very stressed out in the shelter, a toy or an item from their previous home isn't going to really make too much difference. They're going to just be so stressed out they won't care. And on the alternative side of that, if they have a toy from home, I mean, I don't think that they're in their head thinking, I wish I was back there. I mean, I'm sure they are, but if they're going to be fine with that, with you interacting with them, that's the bottom line. I really don't think any object makes any difference. The only thing that I've really seen make a difference is when we use the pheromones and try to kind of help calm them by using feel away and that sort of thing. That I've seen a big difference with that. And with dogs, using some of the behavior medication can help. But, a dog may be a little more attached to a toy than a cat would be, or a blanket. I mean, the problem is you bring some of that stuff in, and after a couple of days, it doesn't smell like their previous home. It's kind of worthless at that point. So it's never a bad idea to do that. If you have to surrender your animal, bring something along that they like. But I don't think it's going to make a big difference ultimately how they do either way.
Okay. All right. Well, we also kind of, I guess this kind of jumps a little bit back in our conversation a little bit. And like I said, Harriet, you lied. Like I said, last question, I'm glad you ignored that. And I told you to ignore that because you have some great questions on there. But she mentioned that, we were talking about feral kittens. You mentioned that they come in and they're very feral, but the cats are very feral. And so kind of what goes through your mind? What are the various determinations that you use to kind of decide whether or not, if you feel like a cat really is a better TNR candidate or a kind of a more adoptable candidate?
Yeah, so some of that just comes with experience and time and dealing with enough cats that you kind of get a feel for whether a cat is going to be turned, able to be turned around, or if it just is acting completely 100% feral. That's not that difficult to determine. However, for the most part, if a cat comes in from a home, it's been in a home, we know it has a home history. If it's acting kind of feral, we know that that's stress related, and it's probably not that someone had a feral cat in their home. So those are the cats you can work with for a few days and kind of see if they calm down. Usually give them like a 3-day period to decompress. And a lot of the times those cats will come around and we can adopt them out. If somebody has found a cat as a stray or, outside, you don't know. You don't know what their history is. If they're acting like a feral cat, they're probably a feral cat, especially if they're intact. It's probably a feral cat. Now, a lot of those intact animals that come in from as a stray are friendly and happy as a clam. And then you just spay them and neuter them and you move on with your life. But it takes experience to have worked with enough cats to kind of get an idea of what behaviors you're looking for. Every cat is obviously an individual and will do different things, but every day, that they're there, especially if they have a stray period, and so we kind of have to hold on to them anyway. If they've started to really increase in their behaviors positively during that stray period, then we can kind of assess. Now, there's some cats that get to the point where we can handle them and they're, okay with us being in their space, but they're not necessarily going to be cats that we think are going to be good pets in somebody's home. Maybe little bit better as either maybe a barn cat or going back outside. But having people that are willing to take cats as barn cats has really been helpful as well. They're cats that aren't necessarily, they shouldn't really go back outside because they didn't live outside. They were in someone's house, but they aren't really, they might get overstimulated and they might end up biting somebody because they touched them in the wrong spot or whatever. Those are great candidates for going to live in somebody's barn outside or outbuilding or whatever, or in a shop or something. It's I wish we had more homes for that kind of a cat, honestly, because that's a great program.
Yeah, the barn cat, I love hearing about the barn cat programs because it does satisfy so many needs for some of these cats, but also people as well, and provides kind of a nice use for there. Now, Alma does have a question, but I'm going to kind of go off this question a little bit, Alma. So I'm sorry about this. So you said, please speak about declawing and the harmful effects. Now, in the shelter world, in the spade, you don't typically do any declaws from there. Now, and so there's not as much from there. The question that I do have is, when you have some animals surrendered, of course, the rate of declawing has dropped precipitously, which is fantastic. But do you ever see any animals that are surrendered that are declawed, and do they have any particular kind of quirks or concerns when they come in that you kind of have to watch out for?
I would say, honestly, it's pretty rare these days that we get a cat in that's already been declawed. Because like you said, it's really decreased, and most people realize what the downsides to it are. And I mean, personally, I am not for declawing. I realize that there are maybe a situation occasionally where it's could be possibly a positive thing for the owner, so that the cat can stay with the owner. But I've seen too many cats get declawed as adults that don't do real well. They're just painful for the rest of their lives. So, but I would say, luckily, again, there could be usually you see litter box issues if the cat has been declawed and they're still having pain, or they're just limping around their whole lives. They're spent now limping. But luckily, this day and age, we really don't see a lot of cats coming in that are declawed. And I would say, in a shelter environment, if you're getting some surrendered cats in, they might be declawed. If you're getting them as strays, they're not. They got their claws and they're good to go on that in that respect. But yeah, I'm definitely not for declawing. I hope nobody's for declawing nowadays. And there are other things you can do to deal with your cat, rather than taking basically the first digit of the bone of their foot out of their body. If you just think about having this part of your finger removed, think how great that would feel. All of them, every single one. That's just, yeah.
Yeah, and that is the very specific reason why we've been able to make such. I think there was such a big shift in that. I think probably when you and I both went through vet school, we were taught about it and how it was kind of a normalized thing, and then pretty quickly after that, it really was.
When I first started as a vet, I did it, because that's what we did at my clinic, and we had a laser, which was supposed to be so much better. You're doing it with the laser; there's hardly any pain, but the bottom line is you're still taking a piece of bone off. So, there's really no good way to declaw.
No. But yeah, so that's why I say that, Alma, we don't really see that. Like I say, you don't really see that in that shelter world all that often anymore, which is fantastic to hear on there. It is a tough process on there. Now, okay, perfect. So we've covered a lot of different topics here. So we talked about kind of kittens going home, the socializing of kittens. Oh my goodness, we bounced around all so many different places that I'm getting my list kind of confused in my head. So I'm gonna ask you a little question real quick. So right now, is there anything you feel like that we haven't covered that you feel like is so important that you kind of want people to know about shelter medicine, shelters? From there, I know there's some certain connotations in shelters that people have that certainly can be improved.
Yeah, that's probably the bottom line. Is I think people just don't. I think they have ideas about shelters maybe that are misconstrued. A lot of people just have bad thoughts in their heads about what goes on in a shelter and how it's just horrible, and there's feces everywhere and nothing's clean, and animals are just scared and in the back of the cage or whatever. The people who work as shelter veterinarians and technicians and animal care are just the most dedicated people that I've ever dealt with, that I've ever worked with in medicine, much more so than any clinic I've worked in. You know, you're there for the mission because you're not getting paid well. You could go to a clinic and get paid way more.
Yeah.
So you're there for the mission because you love that work and you love the animals and you want to do what's best for these sometimes discarded animals. So keep in mind that it's stressful. It's very stressful. There's the whole compassion fatigue situation. I'm lucky because I don't have a personality that really succumbs to compassion fatigue. So I think that's why I do so well in a shelter environment. And I always keep in my head the positive work that I'm doing, and I don't dwell on the negative things that happen, because there are negatives. You know, we have to euthanize animals sometimes. But keep in mind that the people that are working at those shelters, they have the best interests of those animals in mind all the time. And, you know, whatever you may say, there's always bad apples or whatever they like to say. There's always going to be shelters that maybe aren't up to snuff. But keep in mind that we're doing the best work we can to get these animals out into good homes. Mm-hmm. And don't be afraid to adopt an animal from a shelter, because they make really great pets. And don't be afraid if you have to surrender your cat to a shelter. I don't want you to feel like you've just done an evil task or anything, because sometimes it has to happen. That's sometimes your only recourse for your animal. And trust that we are going to take the best care of that animal that we possibly can. Mm-hmm. And, you know, it's the politics of shelters. It's a whole nother, could do a whole nother hour and a half webinar on that. And the people that are in charge at shelters and that sort of thing. But the medical side of working at a shelter, those people are just the grade A people that are they just want what's best for animals above all, because we're not getting paid for it, basically. It comes from the joy we get in helping animals out and getting them into new homes and not suffering.
Well, and that's such a great thing. And I think that's the message we really want to send here, is that, you know, the shelters they're really working for the good and the health of the animals. Just like Harriet mentioned that she donated her time, donations of time, and kind of call your shelter, see what they need. There's usually a list of things that
time, resources, material items, money,
all those sorts of things. So, talk to your local shelters, your local rescues, check them out. And you make sure that you feel comfortable with them, that you like how they're running. It's always best to see something in person so that you know what your time and your resources and what your money are really benefiting on there.
And you can demand transparency. So, ask questions if you're concerned, and make them show you their numbers and things like that. Mm-hmm. Hold them accountable.
Absolutely. And that's what we really want to pass on here is, of course, you do so much good for these animals, but the spaying, the neutering, the helping them adjust and transition to all these new homes, it drives so much of that love that we have, I think, as a culture, is by giving them that good start that we can go from there. And so yeah, I think that's really our love and main message on here. So I thank you so much for your time. I think we're gonna go from there. And then if you do have any more questions, please leave them in the comments. If you're watching this later, drop a question in the comment. We'll get back over to there. And again, thank Dr. Steller for her time and her work to help make sure that these cats are healthy as they come out, and for all from there. So
thanks for having me. It's been fun.
Perfect. Good. All righty, folks. Well, everyone, have a great day, and make sure that you stay safe out there. Bye.
Bye.